The government's vaccine gamble, spending big and taking risks when so much was unknown, paid off. By any measure, it's been a huge success. And now we're still spending big and spending early on other treatments, at times before we've got the full data. But some in healthcare now believe it might be time to think again. Only today the government announced a new drug to treat COVID, GSK's Sotrovimab. The UK has ordered 100,000 doses. It is claimed to reduce the risk of those with COVID needing to go to hospital by 79%, and it's given by an intravenous infusion that takes 30 minutes. It sounds great, but some worry actually deploying it may not be so simple.
So we're getting these trials announced in unvaccinated people, and that's not the reality in the United Kingdom. GPs are overwhelmed. We can't expect British patients to notice their symptoms, get tested, get treated within 5 days of symptoms. That is so quick. It's very hard to do that. And this intravenous infusion that involves, intravenous infusion is a difficult procedure. It's very hard for GPs to take that on as well. Who's actually going to do that?
We know much of this because the full trial was published recently. This wasn't the case when the UK regulator approved another drug, Molnupiravir. A press release from the company that markets it, Merck, announced that it would reduce hospitalisations or deaths in high-risk people by 50%. At the time, Newsnight was cautious about this statement because we hadn't seen any data and we still had questions about how well the drug would work in people who had been vaccinated or who had antibodies following a COVID infection. And now, over in America, further data from a key clinical trial have been presented to the drug regulator there. These data show the reduction in hospitalisations dropped to 30%, and that wasn't all.
With Merck and Molnupiravir, we hear the good news by press release. We don't hear the bad news. We've heard about one study where there was a 50% reduction in hospitalisation early on. Later on in that study, there was no benefit in the second half. It shows some benefit for people who are antibody negative. Now, in the UK, most people will be vaccinated, they'll be antibody positive. If you look at the antibody positive people in the study, there's no benefit at all. So why would we use this drug for vaccinated people in the United Kingdom? Is there actually any use?
Merck said it is not yet clear why such a difference was observed in the two parts of the study, but they're confident in the clinical data for Molnupiravir, which consistently showed a benefit when taken as directed within 5 days of symptoms. The UK was the first in the world to approve Molnupiravir and bought around 480,000 doses, announcing it would reduce hospitalisations by 50%. We don't know how much the UK has paid, but other similar countries have paid £500 for a course of treatment.
It's at the upper end of expenditures on a single drug, undoubtedly. And it's okay if it was going to produce the benefit that's expected. In times of crisis at the beginning of the pandemic, you want to move quickly because of the costs of moving slowly. But we're not in that state anymore. We're now in a position where we do have the time to wait for better data. And one has to ask why that didn't happen this time.
Some argue that it's worth spending big on drugs and vaccines just in case the current crop aren't as effective against emerging variants. But others say we need to start thinking about the impact of doing this. There are lots of other areas of health that need funding too, and people with other conditions could miss out.
We've got to start being responsible. We're out of crisis mode now. We're moving into endemic mode, and we're going to see new variants turning up, and we can't, every time there's a new variant, throw hundreds of millions or billions of pounds at a technological response. That's not sustainable. We need to sort of revert to the usual evidence-based, careful assessment of how to spend the monies that we have.
Hello, good morning.
The government's vaccine strategy paid big dividends, and unknowns, not least new variants, undoubtedly lie ahead. But questions remain over the long-term wisdom of gambling as a strategy.